K2, that comes out to 1.1 milligrams a day. And remember, I told you vitamin K2 comes in those two subforms, MK4 and MK7. Those are probably the two most important ones when it comes to supplementation. You want to make sure you're doing about 1,000 micrograms, which is a milligram a day of MK4, and about 100 micrograms a day of MK7. So vitamin K2, insufficient amount, is going to leave your heart and your arteries at risk. Now let's move on to the second risk factor, hormone imbalances. And let's first look at women. There are two hormone imbalances that might actually leave women at risk for heart disease. One is called estrogen dominance, and the other one is simply low testosterone. Now, estrogen dominance is a situation where estrogen and progesterone are no longer counterbalancing each other. These are two very important hormones to both men and women. But as women get older, the estrogen to progesterone relationship is lost. Now, even though as women age, both estrogen and progesterone are coming down, your body's not making them as much, but the progesterone falls off at a far greater rate. And for an aging woman or an aging woman, we call that estrogen dominance, and that can leave the heart and the vessels at risk, specifically for damage to the lining of the arteries called endothelial cells. It also leaves you with that pear-shaped body where you're putting weight around your waist. And waist circumference, central body fat, that's one of the greatest predictors of risk for heart disease than, say, BMI. The other one here is simply low testosterone. Low testosterone in women kind of leaves us more in that apple shape where we're putting body fat kind of all over. And low testosterone also predisposes women to heart disease. And here's a study that hammers this point home. This was a study done in low testosterone in women, okay? And it's actually being published in the European Journal of Endocrinology just this month. And they looked at 2,914 women, and they followed them for 4.5 years. And they were measuring total and free testosterone. And what they noticed is that the women that had the lowest amount of testosterone, the women in that lowest quarter, they had the greater risk of having a cardiovascular event. And this risk was independent of the traditional risk factors. So once again, you could have normal cholesterol. Your blood pressure could look great. Your doctor gives you a clean bill of health when it comes to those traditional risk factors. Yet if you have low testosterone as a woman, that leaves your heart at risk. It independently predicts risk. Now, men, on the other hand, it's about low testosterone and too much estrogen. As men get older, we don't make testosterone like we used to, but then some of it starts to convert into estrogen. And this does leave us at risk for heart disease. The reason we don't make as much testosterone as we get older, the cells within the testicles called the Leydig cells, they simply degenerate. They just don't do their job as well. It's just part of the aging process. So testosterone level or testosterone production drops. Now we still make some, but here's the funny little trick nature plays on us now. So we're not making as much, but we make some, but not as much. It's going down in production. And then what we do make has a higher tendency to be converted into the estrogens. So an aging man's testosterone to estrogen ratio goes down because testosterone's coming down, estrogen's coming up. It's an imbalance that leaves our heart at risk. When men lose testosterone and gain estrogen, it does three things. It increases the adrenal gland activity, and that's going to release more stress hormones, and it's going to release the adrenalines, the norepinephrine, the epinephrine. The cortisol and the epinephrines, these are very stimulatory to the cardiovascular system. Heart rate goes up, pressure goes up. Along with the adrenal activity and the cortisol, men tend to put that weight around the waist on. And remember, waist circumference is a significant predictor of risk. And then the last thing that happens when testosterone drops and estrogen goes up is it damages the lining of the cells. If you look at this cross section here on the slide, you'll notice here that the blood flows through the lumen here. And right against the blood are these cells right here that I'm outlining with my cursor. These cells are called endothelial cells. Endothelial cells are very metabolically active. They're basically the cells that kind of control how an artery dilates and contracts in response to needed blood flow to a vital organ. So if these cells that control that expansion and contraction to control blood flow, if they get damaged, the artery becomes rigid. And that's not good. That's not compatible with life. So men with low testosterone, higher estrogen are not only putting the fat on around the waist, they're damaging the lining of the arteries, leaving them at significant risk. So what are we going to do here? Well, the best thing for both men and women is to check your blood levels for hormones. That's number one. Life Extension offers a extensive array of different blood tests that we can look at your hormones with. But for women, it's about eliminating some of that estrogen dominance. Progesterone creams, for instance. If your testosterone's low, maybe getting a prescription for testosterone from your doctor. Of course, remember, you get your blood tested first. Also noticed here for women, I listed DHEA. DHEA will convert into testosterone in both men and women. Now notice I didn't put a dose here. That's because the dose of DHEA that you'll take, and this is over the counter, is going to be determined by your blood level. So really, in order to correct imbalances, you have to know where the imbalances are first. So I strongly suggest that you talk with your doctor about checking a good hormone panel. Men and women. Start there. And then based on those results, you can start correcting these imbalances. For men, it may, after you get your blood tested, maybe it looks like you're a little low on testosterone. So maybe you get a testosterone prescription, a cream. Testosterone for men also comes in pellets and gels. Men can also do DHEA, and again, the dose will be based on your blood level. And then the last four that I have listed here for men, chrysin, grapeseed, zinc, and alpha-D-glucarate, these are natural ways to slow down the conversion of testosterone into estrogen. The enzyme that runs that conversion is called the aromatase enzyme. That tends to increase in activity as men age. So there are some natural solutions to slowing down that enzyme. So that way you keep more of your testosterone as testosterone. All right, let's go on to the third risk factor. This one is called low peroxidase 1, or what we call PON1. Now, in order for you to understand the significance of PON1, I want to talk about what's called the cholesterol cycle. Cholesterol does come somewhat, if you look on the right side of the screen here, cholesterol does come from your diet, but it's mostly made in the liver. That's right, your body makes most of the cholesterol you have. The liver makes it. Now, once that cholesterol is made, it has to get from the liver to the body, to the cells, to the tissues. In order to do that, the cholesterol is packaged in a molecule called LDL, low-density lipoprotein. That low-density lipoprotein travels in the blood, you can follow my cursor here, out to the body, out to the tissues, where that cholesterol then is released into the cells and tissues from the LDL. Any excess fat and cholesterol is then picked back up and travels back to the liver. It's the bottom part of this cycle via the HDL. That's the high-density lipoprotein. That's what most people consider the good cholesterol. It's considered the good cholesterol because it's taking all that excess fat and cholesterol, it's taking it out of the arteries, it's taking it out of the cells, and it's taking it back, carrying it like a truck back to the liver, where those excess fats and cholesterol molecules will be processed.